What is up, y'all? Kevin Kuhn here from Athlete Factors. This is the Athlete Factors podcast. My guest today is Sean Lopez. He's a manual therapist. How you doing today, Sean?
I'm good. Thanks for having me.
For sure, man. No, it's a pleasure to have you. I'm really excited to get through some of the topics that we're going to discuss today. Um, you and I met at the beginning of this year,
Yeah,
correct? Yeah, on the
correct.
first over
Yeah,
at the Resolution Run at Run On. So we got to chit chat a little bit then, and had a few more conversations since then. And I think kind of the topic that we'll go over today is going to be really important for people to hear, especially athletes. I think it's going to be really useful information just because there's a lot of massage therapists, manual therapists out there, and it can be really difficult to separate the wheat from the chaff and figure out, who's a quality therapist, and how do you find them? Let's say so.
yeah,
If you will, give us a little information about your personal background, your professional background, and academic background, and kind of how you got into manual therapy.
yeah. It's been a long road coming. To tell you the truth. Maybe about 10 years. Um, and in those 10 years, I actually started off as a personal trainer. And as a personal trainer, um, I always wanted to work with like the athletes and do these cool, explosive workouts. I became a trainer more or less right after I did P90X. So
Mm.
I was inspired to come out with some cool exercises and workouts, right? So
Yeah.
anyway, when I was placed into because I worked for like the big franchise gyms, like your 24-hour fitness. I did Fitness Connection as well. Um, and those gyms, at first, um, before you build up your clientele, the sales team will send you people, right, to help build your clientele.
Yeah.
So, like I said, I wanted the athletes, I wanted to do cool workouts, but for whatever reason, I had like the geriatrics, right? I had like the
Yeah.
older clientele for whatever reason, right?
Oh
So
yeah.
they were sending me maybe like your, I don't know, 50, 60-year olds who just had post operation, who are having struggles just sitting and standing and walking up and down stairs.
Yeah.
So instead of like as far as my workouts and the workout programs I was delivering to these clients, I had to definitely take a step back and couldn't do the cool plyometrics like I wanted, right? Um, yeah, that I totally wanted to do like a
Yeah.
bunch of chin ups and push-ups, but yeah, I had to take a step back and do like sit to stands or something.
For sure.
But yeah, so
That's
but
one of those things, man, about corporate fitness. Like that's where I got my start while I was in grad school studying, you know, strength and conditioning for collegiate athletes and professional athletes and high school athletes. I'm working at Gold's Gym, and there's
mm,
no athletes there. It's all uh,
yeah,
soccer moms and some elderly individuals and like regular everyday folk, but they're not training for a particular sport. So that's one of those things, man. So many trainers get
yeah,
into it because like they want to work with athletes, but that's one of those things is it's there's not too many athletes there. So you sink or swim real quick. You either figure out, okay, I've got to adapt my style of training, or
yeah.
I'm not gonna make it here. So yeah.
Yeah, and I think giving that, starting off with that like clientele, really more or less molded who I am today.
Hmm.
So from a personal trainer, I then decided that I wanted to take a step um, deeper into my education and knowledge and all that. So I did do a PT assistant program as well. I actually never completed it, but I went through like maybe about halfway through the schooling of PTA. And at that time of in my life, I was going to school and working and just juggling a bunch of stuff. I actually decided to put school on hold, continue to work as a trainer, and then a few years later, I went back to school, but instead of PTA, it was for massage therapy, because in my head I was like, man, I can more or less do the same thing I want as far as working with athletes. And I was just like, I'll just go to school for massage, get licensed, work on people. It's easier. The program was easier and it was quicker. So that was my main thing. So in a nutshell, I got licensed. Once I got licensed in massage, I knew I wanted to be more in the medical environment as far as rehabilitation, and not in like your spa, and not really as a luxury, but really I wanted to quote unquote fix people, right? So once I got licensed, and then even when I was going to school as a massage therapist, I was already trying to find jobs to work in a clinic, to prepare me in that setting. So I was working a lot with like chiros and other PT clinics. And then at that time, I was actually still a personal trainer, but very part-time. But yeah, now as far as actually being licensed as a therapist, it's about maybe 6 years. I've been in the rehab field for maybe about more or less like 10. But now with all the different experiences I have from personal training and even from the schooling of PTA and what I learned in massage therapy, I just kind of collab and integrate really everything I learned about the body into my sessions right now, into my treatment plans right now. Nice. So that's kind of where I'm at right now.
Perfect. Beautiful. That's one of those things. There's a ton of overlap in all of these health and wellness professions, right? Like chiropractor, physical therapist, massage therapist, kinesiologist, personal trainer, strength and conditioning coach. We're all looking at the same body. We all have access to the same science, let's say, anatomical science, physiological science, biochemical. And if you get to like tunnel vision, or if like on racehorses they put blinders on so that they're only looking forward, like if you get too much like that where you're only stuck in your own in what your own profession has to provide when it comes to education, let's say, you're leaving a lot of potential benefit on the table for your clients. So I think that's the way to do it, man. Like, learn from your experience as a personal trainer, learn from your experience as when people do that, I think they're a lot more successful. So I think that's pretty awesome. Like, I work with primarily adult endurance athletes and youth athletes right now. But before I was working corporate fitness, I was working with people with Parkinson's disease, doing their training, right? And so while I was in that moment, I was like, man, I should be training athletes right now. I shouldn't be doing this. This is boring to me. And then quickly I learned, like, oh my goodness.
Yeah.
If I can work with somebody who has Parkinson's and get them moving better, get them function a little more functional, right? Like, improve their life a little bit, then I can do that for probably anybody. So it's like when you leverage what you learn from all your experience, like, you're gonna make it further down the road. So so let's talk a little bit about your specific philosophy of bodywork. So why do you believe like massage therapy is important, and when is it appropriate? When is it not appropriate? When is it necessary? Tell us a little bit about that.
So, like the way I look at it, and the majority of the people I work on, they come to get massage or body work or whatever because they are trying to be relieved from pain, right? Lots of times I feel like and my observation is lots of times people are in pain is because maybe somewhere along the lines a joint segment or somewhere something's just not moving right, right? Maybe there's a restriction of some sort, either it's joint restriction or muscle restriction, whatever. I think massage is important, is for the recovery aspect, to just break up, especially if you're an athlete. If you're hitting the gym and you're training all this, very hard, 5 days a week or whatever, like you really have to, consider the time for recovery as well. And I think just now, the whole recovery industry is now beginning to get some light. You see like Conor McGregor and like LeBron James and even Russell Wilson. They had just recently talked about how much money they're spending on their body alone, just so that they can perform the way they do. Yep. And I think people are really beginning to understand that, and it is going to be a collaboration of everything. It is going to be massage therapy with proper nutrition and cryotherapy, physical therapy, everything, right? Just the whole recovery industry as a whole. But yeah, just back to like the whole movement part. Massage in general will just help create more movement, more circulation, more blood flow in general. And then of course, there's different kinds of massage therapy as well.
Right. Yeah, and I'm pumped to get into some of those different types. So you view yourself as a part of the whole process related to an athlete or to correcting restrictions, let's say.
Yeah.
Gotcha.
For sure.
Yeah, I think there's, being an athlete or just being active, like there's so many components related to that. It's never as simple as like, oh, I'm just gonna pick up running and I'm just gonna run every day. And like, yeah, you can do that for sure. But if if your joints aren't prepared for that, if you're not structurally sound, if you're not strength training to reduce injury risk, if you're not addressing mobility issues because now you're stuck in the sagittal plane and you're only doing a little bit of hip flexion and a little bit of hip extension, so now you're probably not using your hip flexors completely as efficiently as they should, and your adductors are going to get overworked when the hip flexors fatigue, and all this and all that, right? There's a lot of different things involved there. And so, yeah, your nutrition's got to be on point. Your strength training has to be there. Your rest and sleep has to be legit. Yeah. And you're going to have some restrictions. And if you're not, figuring out a way to address that, then.
And I know a lot of people right now are relying on, massage guns, right?
Yeah.
These are a huge thing. And,
let's talk about massage guns.
Balls, foam rollers, they're all cool and all, but they can only do so much. You know what I'm saying? Like they can only do so much, and I just don't feel like these will never be replaced by the human hand. If you go to a good therapist. So
for sure. No, that's one of the things, man. Those massage guns, like I feel like I know fewer people who don't own a massage gun than people who own a massage gun now. Like I'm pretty sure half the U.S. population got a massage gun for Christmas. And it's like, oh, now I've got the massage gun. Now I can be my own massage therapist. And it's like, well, I don't think, as somebody who has to like, use my hands on my clients, they'll never be able to feel what I feel, even though it's their body, right? Like, there's times where, I'm working on somebody and they're like, you can feel that? And I'm like, yeah, I can feel that. Like, they're like, I didn't even know that was there, but now that you're poking that, I'm aware of it now. And I think you're missing out on a lot of that just by assuming, oh, the massage gun's gonna fix everything. And
Yeah.
well,
That's
it's
a
one of those things.
temporary thing, like I love it. I have
It's
one,
gonna feel good.
yeah, it's gonna feel good, but
Yeah,
that's not gonna replace a good therapist.
for sure. So, uh, I totally agree. Like uh, when I'm working on a client or an athlete, right, and we're addressing something like today, a client came to me and she's like, my knee is killing me. It hurt so much that we couldn't train, right? So, but instead of saying, hey, let's cancel the session, she said, hey, my knee hurts. What can we do? So I did Thomas test on her. Her knee could not even bend remotely close to 80 degrees, let alone 90 degrees. So I'm like, hey, we gotta dig into some of these quad muscles close to the knee. Did that. It was excruciatingly painful for her.
Yeah.
Stretched it out. At the end of the session, retested. Boom, she's at like 80, 85 degrees, feeling a whole lot better. Um, I can do that, but she knows, like, so what do I do to make sure that this doesn't come back? Right? So is it enough to just one session, boom, and then we're back to, life as usual? Like I give her homework and it's like, hey,
Yeah.
it's not going to be as good, right? Like so for her it's doing specific types of foam rolling, specific joint angles, then following that with a specific stretch, following that with a specific band exercise to activate and strengthen the opposing muscle group. And I'm like, hey, doing this twice a day is still not going to be as good as coming to see me and letting me do it. But it's still better than doing nothing or just taking your massage gun and just, you know,
Yeah.
shooting your knee a little bit and then, assuming that's it and that's done with. So, um, yeah, man, like there all these tools that we have at our disposal are fantastic. But like you said, I don't think there's a tool that's going to replace the human hands and the ability
Mhm.
to like feel the tension on a specific muscle group or a specific muscle fibers, or
Yeah.
lack of tension, let's say. Um, so I don't think AI is going to be replacing us anytime soon.
I don't. Mm-mm.
Fingers
Better not.
crossed.
Yeah, exactly. Better not.
Yeah. So uh, there's about a billion different types of massage, right? So we got Thai massage, we've got Swedish massage, we've got ART, we've got percussion, we've got like in undergrad, I remember learning about effleurage and petrissage and percussion massage and sports massage and rolfing and uh, we got all these different things. So what are the basic differences? How would you categorize different types of massage and kind of uh, put them? Are they all the same with just different names, or like
They're
how would you break these up?
yeah, they're definitely not the same. So the general public, like when they talk about a massage, or the general public when they think of massage, um, usually Swedish massage, and what Swedish massage is like your basic nice body rub, and people fall asleep typically, right? It's the ones you would
It's
find like at
relaxing.
or yeah, relaxing, right?
Mhm.
Um,
Got the
then you get
peaceful music playing in the background. You hear the streams and birds
yeah,
chirping.
yeah, it's
Smell the
not what I
candles.
do. And then you have stuff, yeah. Then you have stuff kind of like pet petrissage is I want to say it's almost like a compression. You just it's like like petting, right? So it's
Yeah.
almost like a compression. Um, you can even do that with like on top of the clothes.
Mhm.
But once you start getting into um, like the stuff like Rolfing you talked about or ART
Mhm.
and heck, what other structural integration. Um, so all of that. So as you mentioned earlier, and what I call myself a manual therapist rather than a massage therapist. And I think one big part is the difference between a massage therapist and a manual therapist is that typically when someone's getting a massage, the client or the patient, they're just lying there, right? It's passive. They're not doing nothing. But when you're doing like ART or when you're doing manual therapy, then you want your client, you want them to be a little bit more involved. You want them to be a little bit more active. So stuff like ART and like rolfing, those are very similar. ART, in short, is pretty much, it's almost like a pin and stretch. You pin the muscle down and then you have the client do a stretch. So deltoid attach. And the important thing, just know the attachments, right? Attachment, do the action of the muscle. Bicep, attachment, flex and extend, right? And then you're just going from attachment to attachment. It's usually one direction as well as far as ART goes. Rolfing now, I guess when it comes to rolfing, the big difference between like rolfing or structural integration, because that's kind of what I do, rolfing / structural integration. It's kind of like just a more advanced myofascia release. But the big difference is that it's very specified as far as the direction that you're trying to treat the tissue. So if someone's internally rotated, like what direction would I want to treat the pecs? Stuff like that. Like what direction would I want to treat on your supraspinatus, infraspinatus? If I'm, what action are we trying to induce, right? And the big thing with rolfing and kind of like, what I do is that it's a series of sessions rather than like a one-time fix, So it would be like, okay, in 10 sessions, we're gonna cover all these different body areas, almost like a workout plan. How people have like your chest day, your leg day, back day, arms, whatever. Same thing with like rolfing and stuff like that, but they do it on the fascia lines. So some people don't know about the fascia lines and all that, but yeah, there's different layers and different directions of this fascia. Again, depending on what we're trying to accomplish. Typical session or typical series for like a rolfing session is like 10 sessions, but you don't necessarily have to do all 10 sessions. Some people just get maybe just one session of the front line, and lots of times that'll already relieve the issues going on in your back just because of all the restriction going on in the front, right? So that's everything more or less in a nutshell. At least I tried to break it into a nutshell.
Yeah, no, that's good, because ask somebody who's going to get a massage and they have no idea. Right? They're just like, oh, I'm just going, like, oh, my pec hurts a little bit, I've been having some trouble here, so I'm just gonna go get a massage. Like, okay, well, like, what does that mean? Like, oftentimes people have no idea, right? So just breaking these down like that, I think, is going to be really helpful. With something like that, if you're experiencing like, if it's related to posture, like you said, just addressing like the anterior chain, or like in sedentary individuals or people who do a lot of work seated at a desk all day. There's a physical therapist named Yanda. He developed this way of explaining what he called upper cross syndrome and lower cross syndrome, where you've got forward head position and anteriorly pulled shoulders and internally rotated humerus. And so to address something like that, like, you might have pec pain or shoulder pain from that on one side, but to correct the whole thing, you've got to address this whole situation where, like, the deep neck flexors have to be addressed, the scapular retractors have to be addressed, the external rotators. Like, you're taking somebody from like this position because they're stuck working on a keyboard and using a mouse all day, to being in some thoracic extension, and pulling the head back,
Absolutely.
and that takes more than just digging a little bit into the shoulder to really
Yeah.
address the issue.
There's a lot of clients I work on. Cause I like with me, I work on the abdomen all the time, right? When I every time I work on a client, and then I ask them, when's the last time you ever had someone work on your abdomen? And they're like, oh, never,
Yeah.
never, right? And yeah, you really got to think of a body as a whole, right? As a whole like system, and especially if you're having like low back pain, like dude, you do want your your abdomen worked on because like again because everything's just so compressed. You just want to like open it up, lift it up.
Yeah.
So
Allow that diaphragm to move. Turn off
yeah,
that psoas a little bit. Sometimes that's compressing that low back a ton.
yeah, absolutely.
So, um, I didn't include this in the topics that we'd cover, but I just thought of it.
Uh-huh.
So, another massage therapist friend of mine has talked a little bit about, like uh, when you're doing one of these manual therapies where you're digging in and really, you know, working on not just these muscles and fascia, but like you're changing the nervous system, or
Yeah.
you're affecting the nervous system. And specifically, he was talking about Rolfing and how he would have just this huge emotional response, like the following 24 hours after having a Rolfing session. Do you notice that? Like people will have like these real cathartic moments where they'll either like have these super emotional breakdowns or like feel
Oh.
extremely happy or like because he was saying like uh, the specific areas that they were addressing were for him kind of the areas where like that's where he was holding tension, and so it was like the it was almost like the tension was connected to specific emotions, right?
Yeah.
And so
Uh,
by working out these tense spots, he was able to like I don't know if work through those emotions is the right word, but all of those emotions that were around specifically surrounding a specific uh, issue in his life. It's like
yeah.
something came up out of nowhere, and then all of his thoughts were centered on that immediately after this Rolfing session. So, is that something that you've experienced, and can
I
you enlighten us on what you think that might be?
no. Yeah. So that's a somatic emotional release is what they call it. Um, I've heard about it. Heard about it plenty actually. I never really had anyone uh, experience that on my table. Um, I don't know if that's a good thing or a bad thing for me,
Yeah.
but no, I've never had anyone really go through one. Only the only time someone like shed tears on my table was because they finally found a therapist who understood the body, uh, the way I do at least. And
Mm-hmm.
I don't know. To me, it was kind of like, oh damn, like you really couldn't find someone like you really couldn't find someone like me. Like, oh dang, that sucks. But
It's like that's like a compliment, but then at the same time you're like,
yeah,
well, shoot, there's not too many good people out there then, I guess.
yeah, that's exactly how I
What does
felt.
that
Like,
say
oh
about
man.
the industry?
So yeah, and that's kind of what, and that's the reason why I post a lot on social media, because I kind of want to like break this perception of what massage is, and a lot of people have just this idea that massage is just one way, and it's just, it's supposed to be relaxing or it's supposed to be just this, and they're not supposed to like do movement or whatever. Like I want to break that stereotype. So, and that's why I'm glad I'm having like an opportunity to even speak about this on the podcast. So yeah, and that's the I wanna I just want to change that view of what massage is in the future, at least, or for the future.
Perfect. Well, I don't think I could have segued into our next topic then any better than that. So that was perfect. So speaking of what you at least what you consider a massage therapist or a manual therapist should be doing, let's talk a little bit about uh, specifically what you do. Like what separates you from someone at not going to say any names, but like
I
a
got you.
massage chain, right?
Yeah.
So talk us through the differences, like the specific differences, because that's essentially that the post that you put on Instagram that I was like, this is the conversation we need to have, where you were talking about um, pressure versus technique. Like, what does that mean for somebody who doesn't know anything about the nervous system, about neurology, about soft tissue characteristics? So, like, what is technique? What are you talking about?
Really, the goal again is it's all about how we can bring the patient, how we can bring that client out of pain and optimally move better, right? That should always be the goal. So what I do, because a lot of people always reach out to me, right? And they're like, hey, I want to book a session, blah, blah, blah. I book a session and then they start asking me questions. All right, is this, I tell them like the info, like the price, blah, blah, blah. And they're like, is that a 60-minute? Is that 90 minutes? I'm like, no, that's just the session, right? And I think that's already one part that sets me one thing that sets me apart from most people is that like, no, I'm not just gonna be like, all right, 60 minutes and then boom, we're done. But I'm treating you literally for this session, and in this session, we're gonna start off with assessment. And I always tell a lot of people, like, especially like clients, and I'm like, if you go get body work done and your therapist does not like look at you thoroughly, looking at your shoulders, looking at your, feet on up. If they're not looking at you and assessing you, I just say, hey man, look for someone else.
Mm-hmm.
If you're really trying to look for like results, if you're
Mm-hmm.
really trying to like, get the best, I don't know, treatment, that you can possibly have. So that's number one. Is like I assess in the beginning of my sessions. So I'll work on you. And then even while I'm working on you, like I said, it's all about we're trying to get the body familiarized with these certain movements. A lot of people, they're just so used to how the body is. Mm-hmm. If they're stuck in flux position, they're not used to doing all these dang chin tucks or open up the pec. Yeah. So while I'm working on someone, I'll have them perform whatever the area is. I'll have them perform the action. Anterior tibialis, I'm working. Well, dorsiflex, plantar flex, mm-hmm. Quad, I'll have you like pump your knee up and down. Mm-hmm. Even the abdomen, just breathe. Just breathe, or you can add some rotation, whatever. I'm always trying to incorporate movement. So that's another huge thing that sets me apart from another therapist, is because as I'm working on someone, already the client is like, oh, dang, this is different. I've never had to do this before. Oh, my abs, oh crap, this is different, right? Rib cage, oh man. So those are like big key areas. If you were to go to a general massage spa or your neighborhood massage, dude, there's like 90% chance they're not going to work on your abdomen or sternum or rib cage or anything like that. Mm-hmm. But there's 95% they're not going to assess you, right? Yeah.
Which is, it's so funny. It's the same way in strength and conditioning. It's a little bit different because their idea of assessment is typically strength assessment, right? So it's not assessing to address movement issues or weaknesses or restrictions, let's say. But in personal training, the assessment is maybe a sit and reach test, or maybe like, it's so like, what is this even assessing, right? And like it was very, very ingrained in me while I was in grad school. If you're not assessing, you're guessing.
Yeah, I like
right?
that.
And so what's the point? Like, if that's all you want to do is just guess, like, that's fine. Go ahead and do that. Don't assess. But if you want to be able to show the person that you're trying to work with, the client, whatever, the customer, it's so powerful when you can say, hey, and you can show them. Like, I take pictures of all my assessments. I take video. I'll do
I do that too.
Slow-mo. Yeah. I run it through Dartfish so I can show them joint angles and things like that. And then I can show them in real time. Like, we just did the assessment. Boom, here you go. This is you right now. at the end of the session today, we're going to retest. And if I didn't make any improvement, if this doesn't look better, then don't come back. Because what are you paying for, right? Like, it's such a powerful tool, not only to like empower the client, like, oh wow, I am better. Look, I'm better. It's like a concrete thing. But then that also gives you credibility. It shows, and that's something that you can, you can post that on Instagram, and anybody looking at it can't be like, oh, this guy doesn't know what he's doing. Really? Then how did I do this? Like, I think that's so powerful. The assessment is huge. The assessment and reassessment. It's a powerful thing.
I literally assess for even during, like, because I usually treat one whole side first, and I'll say, hey, get up, move around. We'll do an assessment. Another assessment before I start on the other side, and then so before, during, and then after. Always assess. Yeah. Because I think with me, like, and maybe this is why I enjoy it so much. It's almost like a game. It's like what's working, what's not. Oh no, now your shoulder's higher. Okay, let's do this. Just picking the pieces, picking the puzzles.
Yeah, like that's what's so amazing. The nervous system will adapt in real time, and if you're paying attention and you know what to look for, then you can see these changes, and then you can manipulate things to elicit other changes. And if you're doing things correctly, then you end up at the end with something that's way better than when the person walked in. So I think that's So let's talk a little bit more about the whole pressure versus technique idea.
As far as the pressure and technique thing, this kind of also goes with people who do it on themselves, like foam rolling and massage guns and stuff like that. And I guess the reason why I decided to post that that night is because I know there's so many clients who just say, like, you know what, I just want to go to that place down the corner, that massage place because there's a really strong massage therapist who will just dig the heck out of my traps. Like, dude, what if it's not about just your traps? Like, so that's why, like, again, it goes back to just like, I want you to be familiarized with how the body should move and incorporate that as far as therapists go, incorporate that into your sessions. And like you said, at the end of the day, we're really trying to retrain the brain with all this movement stuff. So I'm trying to think of like an analogy, but you want the body to explore full range of motion, and that's kind of why I want to incorporate these techniques of movement the whole time. It's like, just have your body, let your body be familiarized with how it should move. You know what I'm saying? And with that, like ART, like you're doing the active, you're doing the movement, and you're going from one attachment, you're going from origin to insertion. Dude, like, you don't need much pressure to do that. That'll hurt already. Like, dude, ART. So that's kind of like what I mean when I'm like, you don't have to like stick a freaking elbow in someone's like bicep or pec. You just have them stretch out their pec, and you can like literally just focus on from the sternum down to the attachment point. So, and like small stuff like that, as long as you connect with the tissue, as long as you're able to like pin down the actual muscle tissue, and then you can do the movement, and I promise the client will feel it.
Yeah. And if you're paying attention, you're gonna find the areas that, because probably the whole pec isn't the problem. There's probably specific portions that are gonna be a little bit tighter, and if you are aware of and you're following, like you said, that origin to insertion, you're gonna find the problem areas, and then you can address those.
And even with especially for therapists, right? I don't know if you know this, but the average lifespan for the massage therapist, the average career, the average career is about 4 years because they end up blowing their thumbs, their wrists, their freaking, I don't know, bursitis on the elbow, whatever.
Yeah.
So again, that's where these techniques come into play. Like, that's the reason why I can treat so many dang clients throughout a week, because I'm not blowing out my thumbs or my wrist. I'm being smart about it, about the techniques, you know?
Yeah.
So,
You're not trying to see 20 clients a day?
no.
You know you'd make more money that way?
Yeah.
And then you'd quit in 4 years. That's
I'd
the
have to
thing,
think of
man.
one hell of a business model.
Yeah. Yeah, make money now. Because you won't want to do it later. Dude, that's one of those things, man. It's so sad that like, in order to fix somebody's posture, you got to be aware if you're putting yourself in risky posture. Like,
Totally.
I got to catch
dude.
myself because I'm like, am I hunched over right now? Am I slouching? Like, because when I first started doing this, I'd get home and I'd spend 20 or 30 minutes just sitting on the couch, like digging into my forearms, like, oh my goodness, my wrists hurt, everything hurts. I must not be doing something right because, I don't think it should be like this. Part of it was just a conditioning thing, just getting used to that much volume. Now it's not really a problem, like I don't feel it there. I feel it other places where if I'm, if I'm not maintaining good positions, if I'm not putting myself in a position where I have leverage, right? Like that was one of the biggest things that I learned from my mentor Ambrose is he's always, he's putting the client in a position that makes it easier for him to do his job instead of, what's the easiest way to get this area or to do this. Like, no. Like he's going to take his time, put the client, hey, I need you diagonal on the table. You're going to drop this right leg off. I'm going to put a pillow underneath so that that knee's still supported. But now I have full access to the specific area that I want to get to. And, sometimes the client's like, you want me to do what? Oh, this cracks us up. This cracks us up all the time. I don't know if you've ever experienced this, but I'll have someone come to me with back pain, right? Yeah. And then I'll run them through some assessments. I'll do the Thomas test, and their 1 and 2 joint hip flexors are really short, and I can tell that they've got a just excessive anterior pelvic tilt. And I'm like, hey, I know your back hurts, but I'm thinking this in my head, like their back hurts, but I want to address these hip flexors first. That's going to clear it up, I bet, right? So I'll be like, all right, I got it. Okay, here's what we're going to do. Lay on your back. And they'll be like, okay, my back hurts. The only way they're going to be able to treat me is if I lay down on my stomach. And so they're not listening, right? And so there's times where I'll be like, I'll give 2 cues, right? I'll say, hey, lay down on your back, face up. And they'll still be like, oh, my back hurts. And they'll lay down on their stomach. And I'm like,
yeah. No, that happens all the time.
That
happens all the time. I'm like, dude, no, you're back. Yeah.
Cracks me up. But that's just one of those asides that I'm just like, man, every once in a while it still happens. I'll be like, hey, lay on your left side. And they're like on my back? And I'm like, no, like on your side. And they're like, what do you mean? I'm like, you ever sleep on your side? They're like, yeah. I'm like, do that. And they're like, oh, okay. It's just funny. But that's because they're used to going to a place where they, my back hurts. Can you work on my back? Sure. Lay down on your stomach, face down, go to sleep, squirt some oil on here. Doesn't that feel good? Yeah, that feels really nice. No change.
I love the saying. This is what I start telling my clients. It's like where you think it is, it's not. Right. So, and that really applies to pretty much everything.
Yeah, for sure. No, that's the thing. Like, when someone comes to me with a specific issue, I'm like, okay, all right, that's where your body's really good at telling you something's wrong. it's not always very good at telling you where that dysfunction's coming from. It's just saying, hey, there's a problem. Maybe it's here. And so you've got to assess, what's the joint above that, the one in pain? What's that one doing? What's the joint below doing? What's the other limb doing? Right? For runners, it's so often that, or cyclists, triathletes, like the side that's in pain, it's in pain because the weak leg, let's say, is in such a weird compensating position that now the strong side is doing all this work and it's got to do all this extra load. And so, yeah, maybe the pain's there, but the issue's actually with the other leg. If we correct that, get it stronger, get it able to deal with that level of load, retrain it so that it's functioning correctly, the pain goes away, not because we addressed anything on the side that was in pain, but because we addressed the other side. There's so much of stuff like that. I mean, it's crazy.
Yeah. Absolutely.
All right, dude. So here's what it comes down to for everybody watching and listening. They want to know, how do I pick a competent manual therapist, massage therapist who's gonna address my specific issues as an athlete? How do you right, you can't say, hey, show me your resume. Okay, I'm gonna interview all you guys. Like, so what do you do? How do you find somebody that's legit?
Especially for my athletes and fitness enthusiasts out there, usually I always just say, hey, like, do your research, right? Because some people will be like, oh yeah, I'm just gonna go to this chiropractor down the street or this PT clinic or whatever, and I'm like, like, dude, that don't mean nothing. Like, there's so many different clinics, and all these different clinics offer, different things. So some of the key words that I tell people to look for is movement, functional, like functional exercises, and myofascial release as far as the soft tissue goes. And then the whole myofascia thing, there's different there's different techniques as far as myofascial release, but that's the key word typically that I'll look for when it comes down to that, because there's some chiros, if you just type in sports chiropractic or whatever on Google, there's so many different results, but sometimes, like, I don't know, sometimes they might just do an adjustment, maybe throw you on some stim, soft tissue, maybe they'll work on it for like 10, 15 minutes or so. So that's why, like, sometimes people don't even, there's a lot of people who never even gotten soft tissue at a chiropractic clinic before, but they want it. So I always tell them, like, just look up like chiropractic clinic myofascial, if they offer myofascial release. Don't go to massage services, because there's a lot of chiro clinics that will say massage, and then again, that could be, you're kind of like gambling. Sometimes they'll be the traditional, and then sometimes they'll be a little bit more clinical. But again, keyword that I typically look for is myofascial release, movement, functional.
Gotcha. Perfect. So it's not so much the if they're telling you it's going to be a feel good type of massage, you're going to really enjoy it, it's really relaxing, that's probably not what you need.
No, there's a time and place, right? But
yeah, for sure.
If you're trying to, recover, especially for the athletes out there, if they're trying to recover and perform better, no, don't get that done.
For sure. So awesome. So for everybody watching and listening, at least in the DFW area, they want to connect with you. What's the best way to do that? How can people find you, follow you, reach out to you, ask you questions, etc.?
Yeah, so if you guys are in the DFW area and if you're interested and you want to inquire about sessions with me, I am mobile and I travel literally all over the DFW area. You can go to findyourglory.com. Go to the contact page and just send me a message. to any therapist out here also listening, any manual therapist, massage therapist, or whatever, and you're interested in learning some of the techniques that I'm talking about, you can also go to my page. And I actually just launched the program where I share about just advanced myofascia techniques. So you can go to my website again, findyourglory.com. And if you're on Instagram, give me a follow. I post a lot of helpful tips to both therapists and to people who are trying to do some self-rehab, some mobility tips and some muscle release. It's at Sean Lopez __.
Sweet.
So yeah.
Awesome. Well, dude, thank you so much for taking the time to do this. I've had a really good conversation. I really enjoyed it. Yeah, man. I'm always excited to add somebody to my local network, especially someone that I can refer out to. When there's times people will be like, "Hey, do you know a good massage therapist?" Hey, yeah. You got to go see my guy Sean. So it's always nice to be able to do that, especially here in this area. So I'm really excited to hopefully help out your business and see things grow and see how much the future changes for you. So
yeah, man. Well, thank you again, man, just for having me. And I'm excited for the future. I hope we definitely connect again and
for sure,
do more of these things again for sure.
Dude. Yeah, let's make it happen.
Yeah, for sure.
Awesome. Alrighty, y'all. Thanks for watching and listening. Go follow Sean. If you have any questions for him, please reach out to him. And don't be going to some massage chain anymore. Y'all know better now. So, all right, stay tuned for next week's episode. Adios.
Peace.